Greetings of the day. Myself Dr. Shweta Jain. I am a pediatrician as well as a neonatologist and practicing as a specialist pediatrician in Manipal clinic Brookfield. I would like to focus and highlight some important societal aspect of current generation, coping up with adolescent stress. So stress is the response to external stimulus which could be in the form of challenges, pressure or all the events happening around to you. Stress which makes you enthusiastic or stimulates you to do some work could be eustress, but stress which lands up you into panic situation is distress. Adolescence is a transition from a childhood to being an adult. In this phase, adolescent underwent lots of physical, mental and societal changes around. This is a situation which lands up them into more form of various stress. Let me enlist a few of them. It could be because of the society, like for example some rituals, religion, some culture, some restrictions, or it could be a part of family where there is parent-child conflicts happening, or the relationships are having good conflicts, or there are fights in the family, or it could be friends and peer pressure where for example adolescents land up with some relationship issues, romantic relationship, and then there are conflicts amongst themselves. Or it could be a medical cause where a person is suffering from some chronic disease. It could be related to the social media, the advertising, the internet around, which is one of the hyped up state of current generation. Or it could be sexuality issues which the adolescents don't understand since they are not mature enough to understand right and wrong. It could be again that. Last but not the least, it could be some addictions like drug addictions, alcohol addiction, tobacco, smoking. So multiple factors we can see which can lead to stress at this age. So to assess the stress, there are some scales given by renowned psychologists or psychiatrists in the world. One is HEADS scale, HEADSS. HEADS, it starts from home, education, academics, depression, stress, suicidal tendency, or it could be social behavior. Or we can understand something where we have to assess the child in terms of the relationship with the parents, relationship with the teachers, relationship with their peers and friends. It could be any other external factor which is hampering their thoughts. Another scale which we can say is shades. Shades is again, it starts from school, home, academics, depression, education, suicidal tendency or social behavior. So there are multiple scales to find out how the adolescent is going through these stress forms. So there are no direct treatments, but there are always behavioral treatment. When we say behavioral treatment, it starts right at home. So parents and teachers are in forefront where they can teach resilience to the children. Resilience in terms of understanding and taking all the things positively and not taking anything negative. Trying to develop positive attitude amongst themselves and trying to encourage the kids and the adolescents for whatever their matter of opinion is. So teaching resilience is very important. Second is focusing them and teaching them to live healthy lifestyle. Healthy lifestyle includes teaching them some workouts, teaching them meditation techniques, exercise. As per the science, 45 minutes of exercise can induce and increase endorphin in human bodies, and endorphins gives positive environment inside your body as well as outside. It can lead you to happiness internally. Teaching them about healthy food styles, teaching them about addiction and drugs, teaching them about what is wrong, what is right in terms of all the food habits and addiction habits, focusing upon their overall development, talking to them, discussing with them what are they undergoing through. It could be any topic and every topic. As far as a pediatrician, I can say a parent should try to be a friend of an adolescent, not a parent. So they should have a friendly relationship with their kids, which can actually develop into a positive growth for them, and they can share everything with you as a parent. Practicing case scenarios. For example, if your adolescent is going to an exam, give a mock environment at the home. What would be the exam, how it could be. Try to teach them, preach them and undergo that stress so that they understand the real scenario. So case scenario practicing is very important. And lastly, give them a healthy environment with a holistic approach. Thank you.